So Dr. Ender Saraç, thank you so much. The stage is yours.
Ender Hocam, öncelikle çok teşekkür ederim. Programımıza katıldınız.
First of all, thank you for joining our program. As our minister had said before, from the investments in support to health, and right after that, to have you on stage is important. Of course, we travel, but we only wear masks during our travels. What else we should be worried about? How does this work? How much can we recover in our perspective? Could you enlighten us? Firstly, I'd like to thank our minister for sparing us his important minutes. May I talk while standing up? Please do so. Okay. I have many experiences and I wish to say it. I am 61 years old. I have seen over 200,000 patients, and this virus is a first. This is not a normal virus. I have treated 200,000 patients over 42 years in the medical field as a 61-year-old doctor. And all of my knowledge is obsolete. This is a serious pandemic, and this virus will infect everybody in one way or another. Let's mask up. One day we will travel by plane, someone will cough, and we will get infected. We have to change our systems. My clinic for 26 years have changed substantially. I have relocated and I have set up ventilation and ultraviolet disinfectants with silver nitrate disinfected sterilization cabinet. We have removed the protective clothing. We are disinfecting shoes from the entrance now instead of putting something over it, because this pandemic will continue for 2 more years. People either will give up or re-emerge. I wish to say this is the sad truth. In quarantines led by our presidency, we have managed well thus far with the limitations and curfews, but the invulnerability systems of Western countries have decreased due to lack of D13 vitamins and lack of sunlight. And because of this, the lockdown, the quarantine has to continue in more Western countries, and this will truly impact the tourism negatively. There is no online tourism to speak of. Let's say with the receptionists, with the waiters, with the teachers, with the animation crew, you can't do tourism online. Tourism has to re-emerge seriously. Let's be honest, but get ready for disappointment in vaccination. The DNA vaccination or the vaccination, let us talk about this. When you go through COVID-19, your COVID amount, your anticorps may decrease in 6 months and you might get infected again. The vaccination is not 100% the true solution. I'm not anti-vaccine, but 100% vaccination is impossible, sadly, because the RNA vaccination will be world's first. For example, I've consulted a hotel in Uludağ. In the entrance, there will be a silver nitrate disinfected systems at the door. It will not hurt anyone, nor the clothing. It will be lighting that will be disinfecting you. The shoes will get disinfected, and the ultraviolet scanners and the ventilation will clean the coronavirus. And the people staying on the king suites or bigger suites will have the same thing at their own doors, and people can stay at the hotel without even wearing a mask. This must be an investment. In 2 weeks, let's not imagine that it will be finished in 2 weeks. The sanitation education is lacking. Let's say, yeah, we wash our hands and whatever, but on the background, many things are turning, many gears are turning. There should be a sanitization education in tourism, much like medical. Also, in hotels, there should be gas mask present due to problems in atmosphere that may emerge. And in first aid kits, there should be gas masks included. Much like aftershocks after an earthquake, right now the world is going through an earthquake, but after that, the best policy in tourism will be rehabilitation by spirit, by physical, because people are complexity. There's a lack of sexual performance. Women are missing their period. Children are in depression. We are not making sports. I've been working with Ministry of Sport and Youth for 2 years and Mr. Sinan's coordination. We see tens of thousands of students under our education. The world is changing right now, and the teenagers are adapting more and better to it. Supports for both Turkey and globally. Turkey has increased 250,000 kilograms, 3.5 per person. US is larger. Even Africa, we have increased in weight in Turkey. This is a serious matter. Because of this, hotels must focus on health and sanitation. Sport units, by sports I mean known sports, exercise, not heavy sports or deadlifts. Those are for professional sportsmen. Swimming, Pilates, yoga, trekking, cycling, and whatever. We should make people move. Secondly, we have to eat carefully. If we cannot have a proper hygiene environment, there's another issue. In Bolivia, bird flu re-emerged, and it arrived in Europe, and chickens were eliminated. We see bird flu, and we have a third virus that's emerging from Earth. It won't end by 2021. We must protect ourselves in any way possible. We must avoid obesity with open buffets, grease, and white flour and sugar, and such buffets must be eliminated, replaced by protein and dietary focused menus. We must do this. Second of all, we must motivate people for exercise by skiing, trekking, whatever it is, in both enclosed and open spaces. And there should be health consultants or coaches or teachers, sports teachers in hotels to focus people into sports before breakfast, because our high index with flour and sugar-based foods are putting us at a risk in terms of virus and destroys our immunization system. And protein is the answer, and it has to be included in the menu. Health tourism will increase. We see it emerge. Not just for the body, but for the spirit. We are in a global depression, a hidden depression, and we will pay for this. Our serotonin values will decrease. Our happiness hormones, our serotonins are in decrease. And I'm sorry, our serotonin, also melatonin, our sleep schedules are messed up. We have to, with teas, with herbal teas, we must help people with melatonin to sleep. We must serve them herbal teas to wake them up and put them to sleep. Our masks, for example, I always say this, our masks now, as we see, 1 drop of herbal oil helps on the tip. For example, this is important. For example, when you put on the mask, the nose and mouth, the tiny spot there can be ointed with mint or other herbal oils. Many herbal oils may help. When you enter an airplane or an enclosed space, that may help us. In open buffets, there may be a huge water container infused with herbal oils may actually stop the cultivation of the coronavirus. And this puts us forward. In here, in Buddhism, Hinduism, or other philosophies have really profited from this. We have Mevlana, for example. I was at Konya, and when I visited Konya, even though against the pandemic, yeah, can you take this mask? Even against the pandemic, I've seen many people visit Konya to cure their spirits. They read up on it, and we, as Turkey, has emerged as a spiritual healing spot, much like Bali or India. Hopefully, we will have a national mission about this, be it with ministries of health or sports and youth, and we'll work and create a television program in the following weeks to prevent overweight, to become fit, and to heal both physically and spiritually. And we must emerge in both fields for tourism, be it religious studies, prayers, prayer visits, whatever it may be. We must emerge in this sector because spirits will look for aid in tourism with the temples at Bali or practices in India, and Turkey has Mevlana, and hopefully this will bring many tourists to our country. Since my time is limited, I don't want to speak long, but I wish to ask you a question. I wish to ask a last question in courtesy of our minister. Wherever we go, how can we protect ourselves from the virus? What can be done to simplify? Can we inform our people here? When you get on the plane, how do we sit, for etc.? Whatever we do, we cannot be protected 100%. Firstly, I wish to congratulate Turkish Airlines, but on the planes, you're sitting next to people. Someone sneezes, someone coughs, and that circulates in the air. We should keep our immunity system strong and avoid high glycemic foods. We should not get fat. The thyme oil, or maybe even chewing herbal remains, should be healthy. We touch somewhere, then we forget. I'm sorry, but as a doctor, we pick our nose, or scratch our eye, or touch our mouth, thinking something. That's when the virus strikes. We should pretend as if our hands don't exist. We should not touch anything. No eyes, no nose, no mouth. Never. Please, work on clothes. Chewing clothes for 5 to 10 minutes disinfects you. Do not swallow it. It may be toxic, but it will prevent the virus from entering. Be it eucalyptus or mint solutions or herbal solutions. And I'm sorry again, but when you sneeze, when mucus emerges, you should moisturize it and drip some herbal oil on your mask or on your mouth, and hopefully blockade all entrances of the virus. Exercise and sports is important. We've become lazy, we've become fat. We must work, we must sleep and synthesize melanin and many herbal fruits. And one such example would be peaches and melissas and many. And male sexual performance has been on the decline during the pandemic. Our testosterone levels are lowering. The red ginseng or maca, Latin American and mata tea. Women's periods has been disturbed. Many herbal teas and many lion claws or maybe other herbal tea perhaps. Nearing menopause especially. This individualism has emerged in health and tourism can adapt. This is a fantastic organization, by the way. Thanks. And I must say this individualism and the support is important. The virus doesn't transmit sexually, but sexual tourism is also a thing, sadly. But sexual tourism will emerge with our immunity systems rising with such additions such as vegetables and garlic and herbal tea, and their consumption hopefully will be fortified with the best medicine, love.